crucial aspect of PPO-Serve's operation is patient data. How it's gathered, how it's analyzed, and most importantly, how it is circulated to those on the front lines of patient care. Introducing PPO-Serve's Intelligent Care System, ICS.
We also collect a lot of other data that generally schemes do not collect, but data that is very meaningful and that contributes a lot to how we manage our patients.
I think we did a couple of things correct in the beginning. The first thing is that we were very clear about being a system that is centered around the patient, not the provider. Most clinical systems or most kind of systems in the health space is a provider-focused system for their patients. ICS is a patient-centered system where providers are part of a team in service of the patient. So I think conceptually that was a fairly important.
The ICS, it is an internal system that we use in PPO-Serve. It is mostly there for patient record keeping, so that our care coordinators who are working on the ground have a platform where they can simply put in anything and everything about a patient. Moving from your medical examinations to your history taking, everything will be there.
Technically, we also understood that healthcare is very complex, and so we adopted fairly early a very robust data model that sits behind ICS that has been fairly extensible and solves most of the problems. So I think ICS patient-centric and a patient-focused, the right technical and data model underpinning it. And then we've also just understood the balance between how you have, I guess, a developer-focused system and one where the end users can essentially configure the system in a way that gives you the ability to rapidly, I guess, roll out different programs. So we got that balance right as well.
The intelligent care system that we have in this program is fascinating. The nice part is about sharing that data. You know, you are able to share your data with your funder, your patient, your provider, health provider, you know, and also to tell the world about us. And you can imagine the stats that come out of it. And that could help us with planning, your policy planning, your health economics. So ICS, I think for us, it was one of the incredible inventions for PPO-Serve and the program.
Another major issue that makes PPO-Serve unique in the private healthcare sector is the way it remunerates general practitioners.
So I would say fee-for-service is probably one of the biggest differentiator. So we say that clinicians should not be paid fee-for-service. They should be paid a global fee, which encourages proactive treatment, which encourages preventative treatment. Number two, it ensures that we pay for value. So if we start paying for value, we have to define what value is. And then we have to measure it. And where clinicians actually meet the targets that we have set for them, we know that there will be a downstream savings in terms of there will be less patients that end up in hospital unnecessarily.
There's currently a notion going around that GPs make around about 3 million a year. I would love to see those practices, but I can tell you the average GP is really struggling currently because the fees hasn't increased the same way than inflation did.
So in other words, instead of encouraging them to do more, we encourage them to do more of the correct procedures that are going to make a difference in the patient's life.
Making a difference in the patient's life also features on our next episode and the last episode in the series, and it's all about PPO-Serve's vision for the future.